Hi there, my name is Johnny Allem. I'm with the DC Recovery Community Alliance. We're an organization of recovering people in the greater Washington, D.C. area. We've been active for about 15 years and carrying a message of recovery that reaches the whole audience, including those people who suffer from addiction today. And it's my pleasure today to introduce Dr. Bob DuPont, who's no stranger to D.C., and he's a star in our field over many, many years. And I'm really going to enjoy this conversation this afternoon. Dr. DuPont actually started his career in this business in the district government back in the 70s. And he began his career serving the DC government. He was chosen as the first director of the National Institute on Drug Abuse and was the second White House drug chief. His new book, Chemical to Slavery, Understanding Addiction and Stopping the Drug Epidemic, is not just a must-read for all Americans, but a picture of Dr. DuPont's dual passion, seeing both the national challenge of this disease and also the ground-level personal view that addiction and recovery impacts individuals and their families. Welcome, Bob.
Well, it's an honor to be with you, Johnny. You're a hero of mine, and I am really happy to do this for the District of Columbia, which is very high in my regard. Always has been. Actually, I started in the District of Columbia in 1968 when I went to work in the Department of Corrections because I cared about the people who were in prison and wanted to do something to help them. And when I got on that project, I discovered that a lot of them were there because of heroin addiction. And that got me to figure out what to do about heroin and start the Narcotics Treatment Administration in the District of Columbia in 1970. And by that time, it was part of the health. That link between the criminal justice system and health was very important to me and got my career launched. As you say, after that, a lot of other things happened, but those days I had 5 years of working for the district government were the happiest years of my working life. I loved the government. Walter Washington was the mayor, heck of a mayor, and it was exciting to be on his team.
Okay, and that brings up the first question we have. Really initiates the mission that you've made your life's mission out of. What are your thoughts on the comparison of opioid treatment model from the 70s and 80s compared to what we're doing today? Now, I know that could take 4 or 5 hours, but just a little caption here.
Well, I don't know, if we just back up on what was really going on, I could talk a little better about what I was thinking about. I'm not sure that's all that was going on. But there was a crisis. We had a heroin epidemic started in the late 1960s that led to a crime epidemic that was a huge issue in the District of Columbia. Lyndon Johnson was president, and he appointed a crime commission for DC. And when Richard Nixon came in, he made this a big priority. So it was a big priority for everybody in the city at that time. And the question was, what do you do with lots and lots of people? The answer was we deployed methadone. We had a lot of methadone treatment, 15,000 people, mostly treated with methadone in the city. That was very controversial. All kinds of things went on with that. And we can talk more about that in the controversy, but that's where I was. I was thinking of public sector activity and MAT and heroin. We called it NTA. We didn't call it Drug Treatment Administration. We called it Heroin Treatment Administration. Narcotics Treatment Administration, because that was where the focus was. What's changed most dramatically is what's going on in my head, and that was I've been in practice my whole career for 50 years, and my patients have taught me a lot more about drugs than any textbook or research project or anything else. And my patients taught me what recovery was. I didn't know what recovery was in all those years. And I got very much involved in that, and I am now. And over the 50 years of my career, the biggest thing that's happened, that's changed everything, is what you're all about, and that is the recovery community. That community was very tiny in 1968, and it is large and very vigorous now, and you're a distinguished leader of that. That's changed my thinking. And I now think about MAT in an entirely different way. MAT is medication-assisted treatment, and that's methadone and buprenorphine and also naltrexone. Those are all specific for opiate addiction, opioid use disorder. And I think that one of the things that is a mission of mine is to get my friends in MAT to think about recovery and think about what that means to be in recovery. It does include not using drugs and alcohol, but it's more than that. It's a change of the person, and I'm looking forward to talking to you about that. But I think the biggest thing that happened in the field is the emergence of the recovery movement. Everybody in the country now has a friend, a family member, somebody where they work with who's in recovery. And I say, look, if you want to learn about drugs, talk to those people who are in recovery. And you ask them 3 questions. What was their life like when they were using? That's the first question. The second question is, what happened to get you to want to change? And then the third question is, what your life is like now? And it's a heck of a story. Everyone is different, but everyone is the same. I just encourage people who are interested to get to know the people around them who are in recovery. They're the teachers. They're my teachers, including you. That's what I've learned in 50 years.
Well, to take that a step further, as you've defined and learned your own experience what recovery actually means, and yet you were driving the national picture in many ways that somehow wasn't totally the same definition of recovery that you've learned over years. And how did you bring those 2 views together, the national view and this personal view that you now think is so important?
Well, it's together in my mind, but it's not together in drug policy. I think there's still lots of confusion about that. And the basic problem is pretty simple. And that is that a lot of people who are very sophisticated and very dedicated and very intelligent buy into the idea that the addicted people that they work with can't get into recovery. That's too ambitious. And they use other goals like using a little less or maybe stop using heroin but still drink or use marijuana. They don't put it together as one package. So the thing that I still have got a long way to go is to get my colleagues in drug treatment to understand it's one problem. It's not, our diagnoses are all substance specific. Alcohol use disorder, opioid use disorder, methamphetamine use disorder, as if those were separate diseases. That when you do medical records, you have a disease and it's one of those. But that isn't what's happening. That's not what's going on. People who use drugs use lots of drugs. Recovery, it doesn't have to do with cutting down or stopping one drug. It's any drug. So I'm a long way from getting that idea across. And I think basically, I have learned that there are no hopeless addicts. Even the most, what looks like the most hopeless addict can get into recovery. And those hopeless addicts are among the most amazing stories in the whole field because what looks so hopeless often becomes a really wonderful human being. And that transformation is what motivates me. That's what excites me, being able to do that. Now, it's as if, Johnny, there's sort of a group of people here who are the using addicts. And then we got something happens to them, and then they become in recovery. So you think about it, if you talk about the ones who are using, they do not feel that they have a problem. They do not want treatment. They do not want to go to meetings and all that kind of stuff. And so all the idea of sort of access to treatment is what we need. Well, we need more than access to treatment. We need to actually get people into treatment because they don't want to go in. People want to go into treatment often briefly when something terrible happens to them. But then the problem is in treatment, people drop out of treatment. Even when it's a wonderful treatment, the big problem is dropping out. So the issue is motivating those people. And that has that second step, I said, that second question, what happens to them to get them to want to do that? And it's usually a story of some catastrophe. Health problems, law enforcement problems, problems of the family, other health kind of things. Something happens to get the person a moment of clarity in that person's life, and they become interested in getting stopping the pain, and that has to do with stopping the drug use, and you get somebody's attention, and then you got to go from there. And the other thing about it is that about recovery is not as if it's done. People don't understand that. You know, when they go off to drug treatment, the families send them off. They pay a bunch of money oftentimes for it, or the government pays the money, and they think, well, the person's fixed. Well, they're not fixed. They've got that changed brain on the basis of that drug use, and they're vulnerable to going back on drugs all the rest of their lives. And that's where recovery support comes in. People don't get that. That doesn't happen with other diseases. It's different about that, and people just don't understand it. When they send somebody into treatment programs, the families think, well, it's your job. You're going to pay this money, and they're going to be fine. Well, that's not true. The government does is get people on a path to treatment, on a path to recovery. But you got to work on that. It's not a job that's done. And one of the things that I think is wonderful about this disease of addiction, first of all, it's a great teacher, but it's the only disease where getting it, the goal is not to be well, it's better than well. The person who is in recovery is not back to where he started. He's in a new and better place. And there's no other disease like that. And that's the thing that keeps me excited about this field.
There is so much that you've said that is true and is being proven more daily every day. But I want to ask you, what do you think the public view and how its change is important? Because it has gone from considering everybody with this issue to have a criminal justice problem rather than a health problem, to beginning barely now you have some people talking about it being a health problem. And we know unless you deal as a health problem, you don't make much progress.
Well, that's right. But you know, remember that I started out in the criminal justice system. So I'm not into vilifying the criminal justice system. I think people who are involved in the criminal justice system generally have some serious problems. And I think it's a matter of what we can do to help those people with those problems for their benefit and for society's benefit. And that's, to me, what I want to do. And that has to do with bringing the criminal justice system and health together to do this, because a lot of people get into recovery through going to the criminal justice system. It's a major door into this. But I think you're absolutely right. And I think that there's a big discussion about stigma in our field and about treating the addicted person with respect. And I think that is really important. The idea that the person who is a drug addict or an alcoholic or whatever else we're going to talk about in this drug addiction phenomenon, the disease of it, is a person who has got a serious problem, a disease. That makes sense to me. But you don't want to normalize the drug use. And when you say you don't want to have stigma, what I say is we want to have stigma to the addictive behavior and not to the person. But if you just give a blanket statement and say, I don't want to have stigma associated with people who are using drugs, I think that's a problem. That actually encourages people to use drugs, to say that. So you say, I care about these people. That really matters to me. But the behavior itself is not healthy. And we see this about cigarettes. It's interesting, and certainly in my life and your life, cigarettes were a marker of social success. That's what the rich people did. And now it's exactly the opposite about the smoking. And that has to do with we have stigmatized smoking. You know, a person's got to apologize for smoke. They've got to say to people, oh, I'm sorry, excuse me, kind of things for this because of social stigma. And I think that's true about addictive behavior, that we want to think about this behavior because it's not good behavior. It's not good for the user, and it's not good for people around the user. That behavior is a problem. We don't want to normalize that. But we do want to respect the people, including the people with the disease and the grip that disease has, because it changes their thinking. This is what we call the hijacked brain, that what happens to the person who's addicted is he or she prioritizes the drug use over everything else, over family, over work, over their own health. kind of things. And that's very powerful. What happens with drugs is that drugs are chemicals that produce brain reward. They hijack the normal brain mechanisms to promote the person's continual use of the drug. And so the person who's using has got to have some help to get over that hump because of that power of that use of the hijacked brain. And it's really a tough thing to do that because the person so much wants to. That's one of the reasons that the hallmark of addictive disease is lying, is dishonesty. It's pretty hard to be an honest addict. And the reason for that is not because of chemistry. It's because around that addicted person are people who want him or her to stop. Family members, employers, judges, all kinds of people want the person to stop. But the person doesn't want to stop. And that's the hijacked brain, and overcoming that is a big problem. The family has somebody who's addicted to alcohol or drugs. The family's got a big problem of how to handle that, how to handle it with firmness and determination, but also with love. And the family's going to make changes too. It isn't just the addicted person. That's a tall order. But it's a benefit to the person, and it's a benefit to the family, and that's exciting.
And one of those things that goes on there, as you know, is low self-esteem that people have who have this disease, and it spreads to their families who also feel very powerless. One of the tools that we've been developing, I'd like your view on, is the ability to develop these peer recovery specialists. Yeah. People who have lived experience in overcoming an addiction and be able to share their stories in their time with some training in a semi-professional manner with newcomers in the field. You've observed that going on? What do you think of that?
I think it's a great idea. People talk about recovery coaches. I think that is really a wonderful thing and a great professional step for those people, and a great benefit that they can bring. But Johnny, the thing that is just, I think, is so important in this, we got all kinds of problems of cost of things and access and all that. I don't know any other disease where we've got capacity to deal with the problem that is utterly free, and that is the 12-step programs and other recovery support. And you got a heart attack, you're going to have to go to the hospital. You're going to have to see the doctor. People can get well by going to those meetings if they'll work the programs that are there. And I just think it's really important to get more people to understand what this miracle is. I say I'm very proud of being an American for a lot of reasons, but one of the highest reasons, at the very top for me, of why I'm proud to be an American is because of AA. Started in Akron, Ohio in 1935. That was just 1 year before I was born. I see closeness to AA because of that. And that was a real American program. There's no money involved in it. There's no credentials involved in it. There's no licensing involved in it. The meetings are all there because the people want to be there to help other people and to help themselves. It's a selfish program because I go to the meetings to protect my sobriety, but the 12th step is to help other people. Well, there's nothing like that. Church is not like that. Health is not like that. It's just a downright American miracle, and it's spreading all over the world right now. And I just think it's a wonderful thing. And for people who are not addicted, go to a couple of open meetings and watch the miracle happen there. It's inspiring. And it's not like anything else. You don't have that with cancer. You don't have that with heart disease. It's really pretty neat. Now, I do therapy, and if people pay me, I understand that. So I'm not against anybody getting paid in the business. That's good too. I think we need that also. But we're building on a foundation of the people who are themselves in recovery, who have found that the best way for them, what's that wonderful line, the best way to learn something is to teach it. There's nothing like teaching it to get you to learn it. And that's the way it is with recovery. You pass it on, and that's exciting. And that's not like any other disease, I don't think, not even close.
Thank you. I want to bring up, you published a number of books over the years, but there's a new one out right now, and I'd like you to talk about it. Right at the front end, you start talking about your view of both the national view and the local view. And you say here that we have to see the disease from the perspective of prevention all the way through to a sustained recovery. Talk about your book a little bit.
Yes, I would like to do that. It's called chemical slavery because the modern chemical slavery that is all around us is produced by the drug use. It's a terrible slavery, absolutely, and it's paid for by the slaves, which is a terrible thing to think about. It's $150 billion a year is paid by illegal drug users in the country for drugs. Some of the poorest people in the country are paying cash for that. But I think that what I want to get across about that is that it's a societal issue. It's everybody's issue, whether you use drugs or not, whether you have somebody or not. You're engaged in this process problem because it's so widespread. And that has to do with, as you say, prevention, treatment, intervention, sustained recovery. All of that whole continuum needs to be put together and used. The prevention piece is, I started off at treatment. I'm kind of going backwards, and now I'm much more into prevention than I was at the beginning. And one of the things that's interesting about this disease, it's a pediatric onset illness. 90% of the people, adults with drug and alcohol problems, began use before the age of 18. Many of them much before that. And that's really important. Brain science, you were talking about the brain science. Brain science has shown us that the adolescent brain is uniquely vulnerable to the appeal of drugs. That getting the adolescent brain using those drugs is training that brain for a lifetime to use those drugs. So the goal here is to help young people grow up not using drugs, not changing their brains to be receptive to those drugs. If they start using drugs later, after 21, they're much less likely to become addicted. And the earlier they start, so if they start at 17, they're much less likely to be than if they start at 14. And usually the most serious drug problems are people who started very early to use these drugs. And it's not a particular drug, it's using any drug that's going to stimulate brain reward. So prevention, the idea of prevention is to help kids grow up, to essentially denormalize, to make it not normal, to define it as not healthy for kids to use any drugs. No cigarettes, no alcohol, no marijuana, no heroin, no methamphetamine. All of those are dangerous for kids. And we need to have an understanding nationally that our goal is to help young people, all young people, grow up drug-free. And what's happened, sadly, is we have normalized drug use in adolescence. We have said, oh, kids experiment. Kids are going to do things like that. Well, think about this with me, Johnny. If you said, okay, I've learned, and when I was young and you were young, nobody had a seatbelt. You didn't know we couldn't get a seatbelt. Nobody heard of a seatbelt. Now we say, if you get in a vehicle, you wear a seatbelt. Okay. Well, let's say that we said to kids are going to experiment. And let's say a kid experiments with not wearing a seatbelt. Okay? That's normal, we're going to say. What do you think the kid would find out? He didn't need the seatbelt, right? He drove that 3 days in a row, had no crash, never needed the seatbelt. Now that kid has learned from experience that he doesn't need it. That's exactly what happens with drugs in kids. They're told it's dangerous. They have heard that story. They try it themselves, and their friends try it, and nothing bad happens to them. Therefore, they say, oh, it's not a problem. Well, you see when that analogy, how stupid it is to normalize kids experimenting with drugs. It's like saying kids experiment with seatbelts. They would not draw the right conclusions from that experience because so many of them are going to have very serious problems down the road. And what I'm after is to get across all over the country at all education levels, income levels, to understand wearing seatbelts is important. We don't have any particular characteristics of that. Well, that's what I want to have happen with the drugs and alcohol. And the three drugs that people use, kids use, are alcohol, nicotine, and marijuana. If they don't use any of those drugs, they're not likely to use anything else. They're all gateway drugs. And so the goal is to help people grow up. And for adults, they say, that's impossible. Kids are going to use drugs. What adults don't know, and what's in this book, is that for the last 4 decades, there's been an increasing percentage of American youth who don't use any drugs. And it's interesting that Black youth have a higher percentage who don't use any drugs than white youth in the country. So it's not a racial kind of thing. It's both, but it's more of that wisdom, I'm going to call it, in the Black community than in the white community or the Hispanic community. It's impressive to me. But anyhow, I want everybody, no matter what, of the kids to understand that the healthy choice is not to use. So denormalization of kids using drugs is really, to me, the principal goal of prevention.
Thank you. What's our challenge in the future, both at the national perspective and the personal perspective that you're outlining? What is our challenge we face as a society to lessen the penalty of drug use in America?
I think to understand what drugs are. Drugs are chemicals that trick the brain, and people are human beings. There's no animal that has a drug problem unless people give it to them, because there's no animal experience with drugs. But people have figured out these chemicals that super stimulate brain reward. People, and they commercialize. People sell them. Illegal drugs are there because the people are buying them, and there's a lot of money involved in it. And legal drugs, the tobacco industry, the alcohol industry, are all into providing these chemicals. So I want people to understand that it's a trick of the brain that is going on, that is going to get lots and lots of people into lots of problems. And we've got to understand that, particularly about the kids. So I think that the main thing is to understand what the problem is. The problem is it's the chemicals that hijack the normal brain reward, and we got to figure out ways to help people understand not to do that. So that's one. But the other thing is about that there's always hope for any addicted person. And everybody around that person needs to work together to help that person get off. I am a very big fan of drug treatment. I'm a very big fan of recovery movement. But I think the treatment, I don't know what effort, the treatment industry is laudable. And many people are called to work in this. And I think that's a great thing that is. I'm very proud of my time in working in drug treatment. When I say to people, if they're choosing a career, you can't find one better than this. And the thing that makes it so wonderful is what happens when people get into recovery. What a miracle that is. That's such a gift to the family. That's such a gift to the therapist. That's such a gift to the people who care about that person. You know, like my patients who taught me about recovery, it was a gift to me, them being in recovery.
The picture there I want to transfer a little bit is to our industry in the treatment field is part of the health field, but is not treated the same as the rest of the health field. And yet I see people who are young professionals in health professionals and are still choosing to work in the addiction field, even though the pay is lower, insurance reimbursements are lower.
Yes.
Parity Act that's been the law for 11 years last October that is not being enforced.
Yeah.
Yet because, like yourself, people have been exposed to this message and it's all become a mission for them. I know in my own business here, all the clinicians I have here could make more money elsewhere, but they're passionate about what they do.
Yeah.
I know people individually here in the DC area that moved into the field after hearing you speak one time or another. So you're a great inspiration to this crew. What do you say to young professionals in the health field about the passion of working in behavioral health?
I don't think there's anything better. And listen, we're going to have to stop, but I want to tell you something about this meeting. The thing that's most important to me is having you here with me. I am honored to be with you. Your life is a testament to the human soul and to what the calling is of people who are in recovery to pass that on to other people. And your program is a marvelous program. And I am just honored as I can be to call you my friend and to share with you this passion that we have about recovery. And the city government, I think, is wonderful too to get involved in this. I think it's exciting. There's room for everybody to get involved, but it's a very positive thing to do, and it's a great career.
Well, thank you very much. Those kind remarks with all the association that we've enjoyed so many years, and to watch the picture unfold in marvelous ways that we didn't even dream of. And there's a lot of room to grow. But thank you again on behalf of everybody at DCRC and everybody in the recovery community for the years that you put into this field. We're so grateful. We're so grateful. And thank you again for being part of this program.
Thanks very much, Johnny.